Hi everyone, Emily from ARC Seminars here with more tips from the therapy floor. And now I'm going to show you how to do compression bandaging or toe bandaging for the toes. This is something you may want to do with your patients who have swelling in the toes, fungal infections in the toes, or things of that nature where you really want to separate the skin of the toes to get your best result. So here I have a foot for demonstration and we're going to get into it. So make sure that you have your gauze. I'm using 4 centimeter Molalast here. This gauze is woven, so it gives a really nice compression without being too irritating on the person's foot. Of course, we've done our skincare and we have our liner on at this stage, but I want to show you without the liner so you can really see the technique. What we're going to begin to do is layering the gauze over top of the foot. We're creating an anchor here, so we go over twice. Once we get to the top, we can start bringing it over at a diagonal angle. Now, I like to do the first 4 toes and to leave the pinky toe out because generally it's quite small. Bandages don't tend to stay on it well, and it doesn't retain as much swelling as, say, the great toe, 2nd, 3rd, and 4th toe. So we're going to bring that diagonally over, lift and separate the toe, and bring it across. So if your gauze is a little long, you can always fold it like so as you go and bring the folded gauze across the foot. I go around the toe, possibly 2 or 3 times, making sure that most of my gauze is around the top and middle part of the toe. We do not want to get it down at the base of the toe where it meets the foot, as that can kind of irritate your patient. So we keep it up here at the top. Then I bring it at a diagonal back around the foot. I try not to keep going in this area as that can create a bar of gauze that can be uncomfortable for your person to step on. So I went a little bit lower, as you can see right there. And I'm bringing this back up. I'm going to fold the gauze again and get it on my 3rd toe here. As I was saying, toe bandaging is not always necessary and it's not always feasible depending on the setting you work in. However, if your patient has fibrotic toes, if they have squared off toes, which is very common with lymphedema, and especially if they have a fungal infection, bandaging is something that's really important to do because it'll help your patient's toes get softer, it'll help the swelling come down, and in the case of a fungal infection, it'll help them from reinfecting the skin around the toes and the rest of the foot. So I've done my 2nd toe here. I'm going to bring that diagonally around again, anchoring in a slightly different location, and back around the foot, where we go to our 2nd toe here. At this stage, the gauze is long enough that it does not need to be doubled over for this longer digit. Go around 3 times, back again, and up to the great toe. As you can see, I'm really focusing on the top of the toe. This is going to help the bandage stay on. It's going to be more comfortable for your patient, which is crucial because if it is uncomfortable for your patient, they'll be taking it off and all of your beautiful work will be for naught. So make sure that you have enough gauze left that you have an anchor. And as you go around the toe, the foot the final time, you should have enough gauze left that it is not going to finish here and slip out under the patient's wrap. At this point, I either stick it to the liner that has been in place, or I can tuck it in to itself like so, or use tape to stick it down. As you can see here, the finished toe wrap should look like this. Diagonally across with the very tips of the toes out, and the toes should be able to move, should feel warm, shouldn't feel as circulation has been cut off. So I hope that was helpful. If you would like to check out more wrapping and compression bandaging videos, have a look at our other videos at ARC Seminars on YouTube. and check out our edema management in inpatient rehab course for all things swelling management. See you soon back at therapy floor.